Hello friends. Today we are going to learn about episcleritis. What we'll learn in today's class is definition of episcleritis, how the patient of episcleritis present to our clinic, characteristic, etiology, investigation and treatment modalities. So let's get started one by one. First of all, definition. Episcleritis. Epi means above. So in itis means inflammation. So episcleritis is inflammation of episcleral tissue. So, inflammation of the tissue that is above the sclera. So, which tissue is above the sclera? So, let's see this diagram. We'll start from the left side, that is the black color part in front is the cornea. In continuity the cornea, this blue color part we are seeing is the conjunctiva. Beneath conjunctiva, there is one red colored tissue that is the tenons fascia, which is continued anteriorly from limbus to the posteriorly to optic nerve. Beneath tenons fascia is the sclera, which is in the red color. Now, in between the tenons fascia and the sclera, there is a green color space. That is the potential space between the tenons fascia and sclera. It is called subtenon space. Now, how this tenons fascia looks clinically and in real life. So we all have done small incision cataract surgery. During that, after conjunctival peritomy, we see whitish tough tissue. We are supposed to remove that tissue. That is called tenous fascia. And we have seen that tenous fascia is adhered to the sclera with small fibril like things. That is called trabeculum. So now we are clear about what is tenous fascia. So episcleritis is inflammation of the tenous fascia, that is called episcleritis. Now, how will patient of episcleritis present to us? Symptom will be pain and redness. Signs. Signs depends on the which type of episcleritis the patient have. It is mainly divided into the simple and nodular episcleritis. Simple episcleritis also again divided into the diffuse and sectoral type of episcleritis. Now we'll see each one by one what it implies. As the name suggests, diffuse episcleritis. Diffuse means inflammation is diffuse in the eyeball. As we can see, the whole eyeball is inflamed. The vessels are dilated and tortuous. Okay. Second is sectoral episcleritis. Sectoral means one sector of eyeball is involved. As we can see, the one sector here drawn in the blue color is more inflamed, and then beneath that part is comparatively quiet. So that is called sectoral episcleritis. It is seen in a triangular fashion where the base of triangle is facing towards the limbus and apex towards the temporal side. Third variety is a nodular episcleritis. As the name suggests, there will be nodule. It is a pinkish white nodule. This type of episcleritis will have a longer course of disease and redness will be on waking up. So now we'll revise what are the types of episcleritis, mainly simple and nodular, simple again in diffuse and sectoral. So whenever the patient comes of episcleritis, we have to write specifically that which type of episcleritis does the patient have, whether patient have diffuse, sectoral or nodular type of episcleritis. Now let's move on to the characteristic. This episcleritis occur mainly in the middle age, around 50 years of age, female. It is a benign condition and recurrent. One episode of episcleritis usually lasts from 5 days to 3 week duration. This is benign condition as in it can cure on its own and it does not have further consequences. Okay, but recurrent episcleritis needs further evaluation. Now we'll see what is the etiology of episcleritis, why episcleritis happen, what causes the episcleral tissue to get inflamed. Usually it's idiopathic, that is there is no underlying cause. Just sometimes in other parts of body what we have inflammation, like that episcleral tissue have inflammation on its own without any underlying cause. In some patients, there will be ocular condition like dry and contact lens use, which can predispose to episcleritis. And In 25% of the cases of episcleritis, there can be underlying systemic condition. This is mostly seen in recurrent cases of episcleritis. So most common is RA, that is rheumatoid arthritis. Second is RA, that is reactive arthritis, that is Ritter syndrome. Third is PA, psoriatic arthritis, gout, SLE, Crohn's disease, and ulcerative colitis. Now we'll see how to remember this systemic condition. See, rheumatoid arthritis is a connective tissue disorder. Connective tissue means collagen and elastic tissues are involved mainly. Now, in the other part of body, how the collagen fibers are involved. In the eye, similarly, sclera and episclera have the collagen tissue. So, if the body in the body, if the collagen tissue is inflamed, it can affect the eyes also. Eyes, connective tissue, or the collagen tissue. So, in that way, we can remember easily by conceptually that they both have similar collagen tissue or connective tissue. So, rheumatoid arthritis. Now, for remembering in the exam, just remember RA. So, RA means rheumatoid arthritis, reactive arthritis, psoriatic arthritis. Now, similar to arthritis is the gout. SLE and a Crohn's disease and ulcerative colitis we have to remember separately. Got it? Now we'll see the investigation. So in which patient of episcleritis do we have to do investigation? If the patient is presenting with the more than 2 time of episcleritis episode, then we have to do the investigation. So routine investigation will be CBC, ESR, CRP and joint X-rays. This we have to do to rule out any systemic associated condition. And then we have to refer the patient to the rheumatologist if any of this is altered. If we are suspecting rheumatoid arthritis, then we have to do rheumatoid factor and NTCCP investigation. In case of SLE and juvenile idiopathic arthritis is suspected, we have to do ANA. CNCA and PNCA, the rheumatologist will do to rule out granulomatosis with polyangiitis or polyarthritis nodosa. Now we'll move on to the treatment part. Treatment is usually topical nonsteroidal anti-inflammatory drops for 1 week. The patient will get cured with these drops only. But if greater than 1 week time is lapsed and still the patient is not getting recovered, we have to give them low potency steroid drops. In case of recurrent cases, we have to give them oral non-steroidal anti-inflammatory agents. And if there is any underlying systemic condition, we have to refer them to rheumatologist to get that treated. So, this is all about episcleritis. Thank you for your time and patient listening. I'll see you in the next video. Till then, goodbye and happy learning.